brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back, everybody. This is Healthy Living Tuesday, of course, and our dear friend, Dr. Jitka Lom from ExpressCare. You are the principal physician, owner. What else do? You sign the checks. You market very effectively.
I answer the phone.
Yeah, you answer the phone. Well, one of the things you have done is you've answered the phone of responsibility to come here today and tell us about nosebleeds. Now,
yes.
Now, nosebleeds, I mean, they're very, very unsightly. Most of us have had them. Most of us have had them many times over our lifetimes. And I would dare to say that most of us have thought that it's actually better to lean back and pinch your nose or blow really hard to get all of the blood out and everything like that. That is actually the wrong thing to do, am I correct?
Well, typically it'll aggravate your nosebleed if you do that kind of stuff. So if you do get a nosebleed, it's almost always coming from the front of the nose, not the back of the nose. The front of the nose, there's an area of really high vascularity, meaning lots of little tiny blood vessels right at the end of the nose on the inside. It's called Little's area, and that can get very inflamed, or if you have a little infection in there, a little crust, it will start to bleed. And so what you should do is just gently pinch your nose and stay upright so that it doesn't drip forward or go back. Just pinch it really hard and watch the clock for 15 minutes. After 15 minutes, release, and I'm sure you'll be okay. I had tons of nosebleeds as a kid, and so I know that you always pinch and look, and you always not letting it clot. And so it needs that time to clot. If you wait 15 minutes, you'll be okay. If you lean back, it drips down your throat, and you swallow it, and it's horrible. Yeah. And leaning forward is usually...
And it's warm, and it tastes tastes really bad, and you can, you know, depending on how much of a sensitive stomach you have, you may wind up, you know, like...
vomiting.
Yeah, which is completely gross. Okay. Let's dovetail back to the root cause.
Yeah.
What actually causes nosebleeds, like across the board? I know there are probably like a variety of reasons, but in terms of science, what actually causes the nose to bleed the way it does?
Okay, so again, inflammation is the most common reason at the front of the nose. Nosebleeds from the back are rare, so we'll focus on the ones from the front. And typically it happens because you have allergies, and everything is kind of swollen on the inside of the nostrils, and you've been rubbing your nose a lot or blowing your nose a lot and creating some trauma, or because you've been picking your nose and there's a mild infection there. And so if you think you might have possibly picked your nose, you could get some antibiotic ointment and just put it on the inside of each nostril, right inside there with the Q-tip a few times a day, and it'll almost always settle it down. It's such an easy treatment. The other thing that can happen is that from the picking and the trauma, especially kids, you're going to get little cracks. And by putting antibiotic ointment there, you lubricate it and seal it so that it doesn't bleed.
Now, of course, that was the very scientific answer. I guess I will give the layman's interpretation of that. There is a purpose for boogers. Leave them alone. They serve a purpose in your body.
Well, clean them with soap and water gently when you wash your face, and then put the antibiotic ointment in there.
Clean your boogers, kids. It actually does.
You should wash your nose.
Yeah. I just love what we're able to say here. The FCC is, you know, thumbs up right now.
The reason is because if you don't clean your boogers, you get tons of bacteria, usually staph infections, and from there you get boils and sores and styes.
Which is a much more complicated process than just a garden variety nosebleed.
Right.
Okay. So I have had nosebleeds, and I know many people have, from excessive stress or stressful situations, maybe even changes in climate.
It's true.
Yeah. How does that affect it? Obviously, you know, you're dealing with inflammation of, you know.
Yeah, inflammation. So when you get emotionally upset, or sometimes if you have high blood pressure or climate change, those little tiny capillaries that are in the Little's area there at the tip of your nose, the little tiny capillaries will swell. Now there's a lot of engorgement, and just a small little thing like a sniff or a sneeze can break them, and then you end up with a nosebleed. So that's one way that can happen. The funny thing about nosebleeds is that they raise your blood pressure a lot. So sometimes if somebody has a severe nosebleed, their blood pressure will be extremely high, 200 over 100, really super high. They'll end up in the emergency department and so on, because then it's sort of like a catch-22 where the blood pressure is high, the nosebleed's going, you need to bring both of them down.
Okay, so we are going to take a break, but you've educated us with so much on nosebleeds. We've got so much more to cover, including the fact that, ladies and gentlemen, I know that Dr. Lom pronounces them as capillaries. I've always said capillaries, but she's from Canada.
Capillaries.
So I'm going to go with her. You know, she's from Canada. She's way more educated than I am. And you stay tuned, because we will be back. More stuff to come after this.